The aim of our reproductive health in disasters project has been to understand how to improve the quality and the availability of reproductive healthcare services during a flood in a sub-district called Belkuchi in Bangladesh. The reason we chose Belkuchi because Belkuchi is flood prone. It sits between two rivers, Horsagar and Jamuna, and it gets flooded annually.
During the flood, most of the mothers faces many problems like MR or post-abortion care. They live remote area. There are difficulties. They face difficulties in reaching the service center.
This research project is very important because reproductive health is central to human health and well-being. Reproductive health is also important to a mother and child's health and well-being, which is currently the Sustainable Development Goal number 3. Reproductive health project is also very unique, partly because it is a complex research project. It has an element of research as well as implementation. We developed an intervention package based on our research component, and then we tried it out through implementation. We had an intervention, and we also evaluated our intervention package so that this intervention package can be applied and replicated elsewhere in other flood-prone or cyclone-prone locales of Bangladesh or elsewhere. Our intervention package RHCC includes 3 components. Component number 1 includes pre-positioning UNFPA's Interagency Reproductive Health Kit 8 prior to a flood. Number 2, building the capacity of the health workers, and number 3 is raising community awareness regarding the Reproductive Health Kit 8. UNFPA's Interagency Reproductive Health Kit 8 were procured from Copenhagen and were positioned in 3 primary healthcare centers in Belkuchi prior to the monsoon season. The Reproductive Health Kit 8 is used to treat complications arising from miscarriage or spontaneous abortion during a crisis or natural disasters.
RH kit is something that people usually do not know about it. Only even the health sector people are not aware about it.
For the second component of RHCC, we trained 10 health workers as how to administer the Reproductive Health Kit 8. We also oriented another 100 health workers from the entire sub-district of Belkuchi Upazila on general awareness around reproductive health and RH Kit 8 and the general issues that women experience during the time of flood. For the RHCC's component number 3, we held 3 community awareness programs in the entire sub-district of Belkuchi Upazila. 400 men, women, adolescents attended this community raising awareness program. And these programs focused on general health and well-being, about the availability of the Reproductive Health Kit 8 in the 3 primary healthcare centers in Belkuchi, and also about general awareness on health and hygiene during the time of flood.
The evaluation of the RHCC intervention package involved conducting 29 semi-structured interviews with the women who received care from the Reproductive Health Kits 8, and 5 focus group discussions with 28 health workers and 4 in-depth interviews with key informants. From our findings, it was seen that the RHCC improved the availability and the quality of post-abortion care services during the flood of 2017 in Belkuchi Upazila. The Reproductive Health Kits 8 have benefited 48 women directly during the 3 months intervention period. This is 20% of the estimated population that can benefit from the 4 kits. The use of these kits is still ongoing. The RHCC also raised the community's awareness and improved the knowledge of 100 health workers through the orientation programs. The intervention package has also benefited 10 health workers in 3 primary healthcare centers in Belkuchi through the training. These trained health workers will continue to provide quality health services on menstrual regulation and post-abortion care. Overall, the feedback from the project was positive.
ট্রেনিং পেয়ে আমি তো উপকৃত হয়েছি এবং মানুষ যাদেরকে হেলথ মানে সেবা দিতে হয়, স্বাস্থ্য সেবা দিতে হয়, তাদের এই সেবা দেওয়ার ব্যাপারটা বোঝানোর মতো আরও দক্ষতা অর্জন করছি এবং মানে স্বাস্থ্যকরভাবে এই সেবাটা নিলে তাদের পরবর্তীতে যে কমপ্লিকেশনগুলো এগুলো থেকে তারা নিরাপদে থাকবে এটা বোঝাতে সক্ষম হয়েছি এবং এর কমপ্লিকেশন যে গভীর কমপ্লিকেশনগুলো থাকে যেটা আমরা আগে হয়তো এই বিষয়টা এত বেশি ভালো করে উপলব্ধি করা সম্ভব হতো না, ট্রেনিং নেওয়ার পরে এই বিষয়টাকে আরও বেশি ভালোভাবে বুঝতে পারছি আর কি। আমার সার্ভিস কোয়ালিটি অবশ্যই উন্নতি হয়েছে এবং সেই উন্নত সেবা আমি মানুষকে দিতে পেরে আনন্দিত।
Many people are now getting services from your project.
I anticipate that RHCC could be replicated in other flood-prone areas of Bangladesh and beyond Bangladesh. And for the first time in Belkuchi, that the reproductive healthcare services were available during the time of flood in 2017, and we hope that those reproductive healthcare services will continue to be delivered during the time of flood in the future.